Patient's on the cot. You're taking the blood pressure. Without warning, they reach up and grab your forearm and won't let go. We're going to show you how to escape this potentially violent encounter. I'm Kip Teitsort, and welcome to Escaping Violent Encounters. You're in the back of the ambulance. Your partner just exited to get up into the front to drive you towards the hospital. You begin to establish the IV when this person reaches up and they grabs you by the arm. This is a situation where they've grabbed you with the same side that you've attempted to establish the IV or the blood pressure on. So from this situation, you have to, in a split second, recognize again, patient or attacker, because instinctively, the moment somebody grabs you on that call, you want to light them up. But that may not be reasonable. Let's take a look at a reasonable escape move for when somebody grabs you like this. Here's something that you and your partner can practice. We're going to call this push-pull, but basically what happens in this one is what we're going to do is as the partner has grabbed their left with your left, what I'd like for you to do is just with these two fingers, kind of like if you're making the I love you sign, you're going to reach underneath and only with two fingers that's going to keep you from grabbing. We don't want you to grab under stress. It's more difficult to turn loose from somebody or something if you clench under stress. That's the reason for the I love you sign. So as your partner grabs your left and being a good partner, they're going to let you work it. You're going to reach up and under, and as you pull to your sternum with your right, you're going to push with your left. And believe it or not, the angle here is going to be towards their groin. You're going to make this line as you pull towards your sternum, your push is going to go towards their groin. So it's a push-pull, but it's not driving this from the ground with these two fingers and trying to strike this off. Literally, you can be touching and then push-pull together. It's push-pull together. Now, yes, there are many more incredible moves, like crushing someone's throat, raking their eyeballs with your thumbs, but these are not things that would be seen as reasonable should you be aggressed upon by someone who is really a confused, uncooperative patient and not that drunk or drugged individual who's attempting to commit a crime. But because we have to make that decision in a split second of patient versus an aggressor, this quick escape move from when they've reached up and grabbed you is a simple pluck and a push. When faced with any violent encounter or potentially violent encounter where there's a use of force, providers are going to respond. How they respond or how you respond will be based upon your training or lack of it. Something as simple as this push-pull, if someone has grabbed you while you're taking a blood pressure or starting the IV, would be seen as reasonable whether you were dealing with a patient or an aggressor while you had a few moments in time to make up your mind, which one am I dealing with? I'm Kip Teitsort, and remember, your safety comes first.